Good evening, everyone. Um, we are here today again this evening with Professor Arthur Chang with us. I think to start across, we also have Jayesh with us, and I'll pass on the mic to Jayesh to initiate the session. Welcome, everybody. Thank you for being on time. Jayesh, we already have 85 people joining us, and maybe in another 5 minutes, we may have more joining in. So let's start. Let's go ahead.
Okay, thank you. So, good evening, everyone. My name is Jay Shinde, and I'm associated with Indira IVF as head of embryology department, looking after quality improvement and quality control. I'm very delighted to welcome you all for today's session organized by Indira Fertility Academy. At IFA, we have taken this academic initiative to spread knowledge, enhance awareness, and elevate scientific understanding in field of embryology. Such webinars are planned free for the community and is scheduled on third Friday of every month. I'm excited to introduce the topic for today's session, which is smarter sperm selection sorting for outcome-driven fertility care. We all know sperm selection is not just a lab step or a protocol. It is a critical decision that directly influences fertilization, subsequent embryo development, and ultimately clinical outcomes. With rapidly evolving technologies, we now have smarter, more precise sperm sorting methods that can significantly improve IVF success. So before we begin, I will ask my fellow moderator, Mr. Naval Shah, who is a well-known face in field in our embryology community, to start the proceedings, please. Over to you, Naval.
Thank you so much, Jayesh. So, to start with, as Jayesh has already mentioned, the male infertility is something which everybody has to really take seriously, and that's what people have been knowing now and looking into it now. And who better than Professor Arthur Chung with us today to discuss on this particular topic, right? So, he has been actually looking into this for quite a long time. He is a professor of gynae at University of Texas. So it's morning for them. So thank you very much, Professor, for being with us at this morning hours. He is at San Antonio, Texas. I'm sure a lot of people know that because this year's ASRM was at San Antonio, Texas in USA. He is director of clinical ART laboratories at UT Health, Reproductive Health and Fertility Center at Brooke Army Medical Center. He has been certified by American Board of Bioanalysis as a high complexity clinical laboratory director, embryology laboratory director, and clinical consultant. Now, these are some of things which not everybody can achieve, and that itself shows his understanding of subject and his expertise into it, right? He's also associate editor for JARC, Journal of Assisted Reproduction and Genetics, section editor for reproductive biology and endocrinology, accreditation inspection team leader for College of American Pathologists. So these are some of the societies, CAP, SART, ASRM will look after to have an improvisation in our quality assurance. And he comes from that background. He has contributions and has been recognized as 2-time ASRM Service Milestone Award and 9 times ASRM Star Award. And still he is so young. Just imagine, I mean, he has been achieving so much. So just think about the expertise and the brain he brings with himself. He's also with Springer Nature he has also had the Springer Nature Editor of Distinction Award, and he has been associated with a lot of other bodies and societies overall, right? So this shows his career progress track, and it is really wonderful for us to have somebody like you at Indira Fertility Academy for this webinar for a hot topic currently where a lot of people are discussing about male infertility. And at embryologist level, what better than a good sperm selection procedures, techniques, and scientific understanding behind it on what to do, what's the latest trend, and what would be the future. So thank you, Arthur Chang. I would pass on the virtual mic to you and ask you to lead the session and us from here on. Thank you very much.
Thank you, Nabo and Jayesh. Welcome, everyone. It's my a pleasure and honor to give this talk, and it's my first time giving a talk specifically for a region in India. I gave a talk for Aspire region before, but not for India. So today I put on my green color tie just to show the fertile and growth color in India. I would like to start discussing the smarter sperm selection. So let me share my slide now. Let me see. I need to go to this one. Can you see the share slide here?
Yes.
Yes.
It's the full screen or split screen over there?
It's a split screen.
Oh, it's a split. Okay, so I need to swap displays. Is that good?
Yes, that's good.
Yes. Yeah, great. So welcome everyone. So I'm Arthur Chang. I'm a professor and lab director at the OB/GYN department at the University of Texas Health Science Center here in San Antonio, Texas. So originally I came from Taiwan. I finished my college there and also the military service. Then I came here to the US and finished my master and PhD in University of Wisconsin. Then I came down to Texas and start my career here. And today I would like to talk about the fertility rate decrease. So it's a global crisis. The birth rate have to decrease rapidly in recent years, regardless like in the developed countries, in also some developing countries, in especially with we know that middle class booming and a lot of young people, they postpone their child bearing ages. And we have in the global market snapshot, we see that a lot of couples, they are unable to have a child. And about 50% of those cases, they are either caused directly or indirectly correlated by male's problem. So many of us, as embryologists here, and also many of audience here are physicians and nurses, and in the fertility clinic, we all try our best to help the patients to have babies. So in the IVF lab, this is the workflow and the key elements, which it will warrant another a 4-hour topic. So today we're focusing on the sperm quality and sperm sorting, the sperm selection. So it's a part of the looks like a small, but actually it's very critical factor because it's one of the upstream a selection process which will affect everything downstream. So we can do a lot of things for the incubators, like culture system, embryology training, and air quality. However, if the sperm quality we pick up is very poor, then it's very difficult to envision a good quality out of that. So in the laboratory, the IVF technology and practice have advanced dramatically in the past 4 decades. There are many new technologies coming up every few years. We have seen the time lapse, PGT, and even nowadays like a PGT, like a polygenic. Those are new technologies, some of them even controversial and highly debated in clinical IVF. Throughout the past 4 decades, we have seen improved fertilization rate, blastocyst rate, and good blastocyst rate, which is very important, even more important than the overall blastocyst rate. Vegetation, warming survival, and elective single embryo transfer, and also all those contributed to the higher pregnancy rate and live birth rate. So those key factors contributing not just the technical part, but also documentation, QC troubleshooting, as well as staff training and competency. So we want to say that the lab is future-proofing. That meaning right now, we have learned a lot from the past and also working a lot on the present. But how to make sure that our planning and also protocols can meet tomorrow's needs. And there are many like a technology and practice. So today we want to talk about how we can make a sperm selection better and we so-called like a smarter. One of the key steps we can do to improve the lab is standardize and streamline the workflow. While for the patients, we often move toward a personalized like to meet the patient complexity. However, in the lab, we want to make sure that the workflow, the basic ones, essentials are standardized, and we can streamline those steps so the staff won't get like overwhelmed, and also junior like embryologists, andrologists, they have a rule to follow. First, I would like to spend a few minutes talking about the sperm processing, how we got today, and how we can going forward from here. The semen analysis, there are normal values, and also if we have values below those, we'll consider them as male factor patients. And there are some key issues to pay attention, and we'll talk about some like sperm, like current preparation methods, and there's pros and cons, and also some tips I would like to share when we work up of severe male patients, which we will try our best to avoid the TC cases, because TC costs a lot, not just the money, but also efforts and also the patient wellness. So we'll try to avoid TC as much as possible, so we can work on the low quality specimen, and oftentimes we can utilize some of the smarter sperm selection methods to improve those. Also, I will spend the majority of time talking about how we can avoid the centrifuge and how the centrifuge-free sperm sorting devices can help us to generate better outcomes. This is a WHO 6 semen analysis normal values. This is the 5th and 6th comparison, and we're all very familiar with this. And the ideal sperm preparation technique should recover a highly functional sperm population that preserves DNA and does not induce dysfunction through the production of the RS by sperm and leukocytes. And sperm is a very complex mixture, so we have to consider that when we do a sperm selection, how we pick up the best sperm cells and remove all the others, like we don't want to yield in the final products. The sperm separation technique should separate those spermatozoa from the seminal plasma and also ensure good sperm quality. And there are different techniques. Some will separate them better. However, we have to consider the dilemma of how many sperm we actually have and how many we actually need. So there's sometimes a compromise, and we want to pick up the best method to actually give us like looking at the both ends and give us the best results. And also a side note is that we want to make sure that the sperm collection and analysis, especially the motility evaluation, is done within 1 hour of ejaculation, so we can have a better understanding of the sperm quality. And not all the specimens behave the same, so the recovery efficiency from different samples may vary. In the lab, we want to make sure that the culture condition, pH, and the media preparation is consistent. So we want to minimize the variation caused by the lab. So even there are some borderline specimen, we can still utilize them. But there are different medium we can use to meet the different requirement. When some of us like to work the sample at the 20 degrees Celsius, and some of us will put on the 37 degree. So there are also some like a multi-handling, like a dual purpose medium out there we can consider as well. For the sperm preparation, those are the most common methods we can do the simple wash. And oftentimes, especially for IUIs, it's commonly utilized by most labs. And we can do a swim up. It's a very we call like old-fashioned protocol, but it still has its value. It actually, compared to the density gradient, the swim up tend to have a better outcome in a DNA fermentation issue. And density gradient is fast, easy, and has been utilized by pretty much every labs. However, it has some of the inherited problem with it, and I'm going to talk about how we can minimize those issues. Depending on the purpose, we want to do IUI, conventional insemination for IVF, or we want to do ICSI. All the purpose is to decrease DNA fermentation. For some patients, they have gone through the DFI a determination and found they have a high DNA fermentation. So for IUI, the sperm quality is usually not that demanding, and gradually moving toward the IVF and ICSI, and also especially handling DNA a high DFI index patients, we want to make sure that the sperm quality is on the top, and compared to IUI samples, we are requiring a better quality. So this is a quick comparison of a commonly used sperm preparation technique. Each of them have advantage and disadvantage. And most of those, I would say, nowadays they involve the centrifuge. Even the swim up, oftentimes we'll split them into different tubes, like in shown here. And oftentimes we might lay out maybe 3, 4, or 5 tubes and incubate, some shorter, some longer. And some of us, we tend to put that upright, and some labs put a 45 degree to increase the surface. Still, after we collect the swim up, depending on the usage, we often spin them down to get a pellet or better quality sample. And for the DGC, of course, the centrifuge is used. And I would like to mention that different DGC from different vendor and different medium actually might yield different outcomes. And I would encourage each lab to evaluate a existing protocol and maybe try out some different companies and see, well, maybe the DGC medium, if we still continue using DGC, then maybe compare the outcomes and select the best ones. When we prepare the sperm for the IVF procedures, it depends on the specimen quality, and we would like to make the specimen for conventional insemination about 50 to 200,000 motile sperm per mil. If you use a 4-well dish, like some labs still use 4-well dish for the insemination, you can put more sperms in there. And I use micro drops. Some labs use 50, sometimes use 100. Then we usually shoot for 5,000 to 20,000 motile sperm for 100 microliter micro drop. And specimen post-wash dilution for ICSI actually can be higher, more diluted, so we can easily search and pick up good morphology sperm. So we are not overwhelmed by thousands of the sperm under the microscope, so we can pick up the good one. And there are a few different protocols utilizing PVP or different reagents to pick up the best sperm for ICSI. For the low quality and male factor specimen, but still okay for ICSI, we will actually encourage the patient to just try the ICSI first and avoid the surgery TC samples. So the process similar throughout the common methods. And also we can place them in some wash or unwashed medium drops, which I'm going to show in the next few slides. Or we can cryopreserve them with multiple batches. Then we store them all together, and we process them. And how many do we actually need? That's another factor to consider. It also relies on how many oocytes we have on the other end. If we have a lot of oocytes and we have a few sperm, we can consider, well, we can freeze the sperm and batch them and store them together for the upcoming, like the retrievals, or we can freeze the oocytes, some or part of the oocytes for the next round. And one interesting things I have seen is the repeated semen analysis on the day of intended TC. Actually, sometimes it helps because due to either the visit frequency or the reference lab, like semen analysis, we have seen that the poor quality semen analysis report. Then on the day of the TC, we run the repeated semen analysis, and we saw, oh, actually it's doable. We can make the ICSI work. So I would say it added another layer of work. But sometimes if we do repeated semen analysis on the day of intended TC, we actually can avoid some cases though. So this is the principle of processing the cryptozoospermic specimens. Those are like very few samples under the microscope, and we can do the high-speed centrifuge. And considering that centrifugation is always harmful, so if we have a high DFI patients, we might even think about not going through the centrifugation. Like here for the severe male factor sperm, this patient ejected with a few, if any, and we just go through like resuspension or dilution or wash the pellet. So we just examine the pellet thoroughly and make sure we cover everything and pick up as many as we could. So this is a video like showing that, yeah, searching, there's one here, only one got searched. And oftentimes we see that there's a lot of like that sperm there, a good sperm concentration, but very few motor ones. We can actually look into the single sperm prep and also look around those sperm on the edge of the drops. And oftentimes we'll see, yeah, no, they tend to show up at the edge though. And there are some sperm motility enhancers. The most commonly used is pentazophylline, and pretty much standard use for the TC samples. And it has been found that for the non-TC samples, oftentimes pentazophylline can also boost the motility a little bit. And when we prepare the epididymal and testicular sperm, those are the key points. Especially for testicular sperm, it can be retrieved by the open biopsy or without the microdissection or by the needle biopsy. So those are contaminated with non-germ cells and red blood cells. So oftentimes we might do a micro kind of swim out. We could lay out the drop, make it kind of like a line or with some like curves and corners, and we place those the pentazophylline added sample in those like micro drops, or we call the micro channels, like kind of like a in-house made microfluidic methods though, to utilize those. And sperm number is pretty low, motility is poor, but sometimes the morphology might not be bad, so we can still try to use those for ICSI. So overall, for the low number and low quality sperm ICSI tips, we can utilize the motility enhancer stimulant like pentazophylline, and we make small drops with a limited field of view for easier search. And we will prioritize the head integrity in the sperm when we select those, because if we have only a few sperm to select, the head integrity is the most important one. And those are some of the key factors we can consider for the low number, low quality sperm exit tips. So the next section, which is my focus, is in most cases, we probably don't need to do the TC, and we are running the samples for IUI and also for IVF. How do we optimize smarter sperm selection technology to improve workflow and outcomes? For the ART lab, we can identify several areas to enhance the quality. We can increase the utilization of technology. We can optimize the practice and workflow. And also, we want to make sure that the technology and workflow we apply can actually minimize non-conformance. So we can do a witnessing and workflow optimization, efficient work, like a paperwork, of course. But one of the things about several new technology out there is they can simplify the process and steps. So the fewer steps we perform, the less risk we have for non-conformance and errors. So for minimizing non-conformances, like I mentioned, we can do those engineering approach. Like in our labs, we use the X1 Pro, and now there are newer version of X3 Pro, those mini CASA, and we are actually start like a testing, and we'll implement the DNA fermentation testing, the X12. Those are the product that we use from the Boundary Bio, the lens hook, and those can minimize our workload and make things simplifier. Also, we can use a pre-stained slides that's from another company. And one of the things I'm going to talk about is the sorting device, which can help us dramatically as well. So I've known the Boundary Bio and lens hook company for a few years. Actually, I started using their product before knowing they actually are they are Taiwanese company, and they come from Asia. And yeah, I flipped the equipment, the machine on the X1 Pro, and realized that, oh, actually it's an Asian company, and it's very interesting. And since then, the adoption and utilization of the lens hook andrology, like a total male fertility solution products in the United States, has been increased dramatically in the past several years. And some of the product has more than 50% market share in the US, which I feel they are very easy to use and reduce a lot of workflow, and actually minimize the headache and non-conformance in my lab. So this is the product line I mentioned. So we're focusing on the sperm preparation, the sorting device on the lower right corner today. So those are the publications. And since then, since a few years ago, I get in touch with the lens hook products more, and happen to participate in some studies. And we found that it's very useful. And the company is working very hard and very focused on doing new research, which is nice to see, because a lot of company nowadays, they don't do much research. They do more like market-driven approaches. However, I have seen that lens hook has done a lot of research in the recent years on the product lines. For the high sperm DNA fermentation specimens, how do we handle those? And how do we utilize the smarter sperm sorting devices to improve the outcome and also help the lab to make things easier? For sperm DNA fermentation, is correlate with unexplained male fertility and idiopathic male infertility, it has been shown that the sperm DNA fermentation has negatively impacting fertilization, embryo development, and euploidy, as well as implantation and pregnancy outcomes. The European Association of Urology, as well as the World Health Organization, has published in their guidelines and mentioning that the sperm DNA damage is more common in infertile men, and also those damage has been identified as a major contributor to male infertility, contributing to the poor outcomes following the ART, for example, like impaired embryo development, miscarriage, recurrent pregnancy loss, as well as birth defects in the offspring. And also in the WHO guidelines, it mentioned that the DNA fermentation has been the key issues and should worth like a more like a examination in the lab. There are a few suggestions and interventions we can provide for the patients. For example, it's very easy to improve the DNA fermentation in some subpopulation of male patients if they change their lifestyle modification, like quit the smoking and those like lifestyle interventions, and also the antioxidant supplementation. And of course, the TC may be a kind of, I would call it last resort. Change your lifestyle, add a supplementation, and if none of those works, then we can try the TCS surgical method to find those lower like a DNA fermentation sperm. When we have those sperm samples already collected in the lab, there's no lifestyle we can change in the lab, and we are not doing TC. And some of the methods we can try out is the non-invasive sperm separation methods, including microfluidics and membrane-based sorting. As I mentioned, currently, even with a simple washing, direct swim up, and the DGC, most, if not all, of the procedures done in the lab involve the centrifugation, including the swim up, like we will pull several tubes together and we still spin them down. And the centrifugation, either through the density gradient or after the swim up, has been shown that it still introduces the DNA fermentation in the final like yielded product we have from the selection. The higher oxidative stress and the higher sperm fermentation we have seen. Also, the H3 guidelines on the add-ons, it talk about the microfluidics and transmembrane filtration, and we call the live sperm sorting. So using those micrometer size channels or the membrane, those can be used to guide the sperm without centrifugation. There are structural obstacles mimicking the female reproductive tract, which also select out the poor quality sperm, and the good ones will move in through those. It's been commonly used for high quality sperm isolated from the semen, especially beneficial for IVF and ICSI. There are increased utilization on low quality specimens for ICSI as well. The key benefit of microfluidics and transmembrane filtration is removing the centrifugation step. As I mentioned, the centrifugation step has been shown that very harmful to the sperm. And nowadays, the modern devices has shown very high recovery efficiency and also easy to use. And all those factors contributes to the improvement of lab workflow and also save time. In the H3 publication reviewing the ART add-ons, it mentioned that those devices, those methods can improve the sperm motility, morphology, DNA integrity, and reduce the oxidative stress compared to the DGC and the swim up. And in the future, there are emerging innovations, maybe integration of chemo attractants, and also combining with optical imaging and some like electrical analysis or flagellar motion. Those are some directions people are looking into. So here are several papers showing that the sperm selection comparing the swim up and density gradient, as well as the live motor sperm sorting, the membrane filtration, and shown that the DGC is usually the worst compared to swim up and also the membrane-based or microfluidic-based sperm selection. The higher DFI, the lower pregnancy rate. So we want to minimize the DFI. One of the easiest way to do in the lab is to just remove the centrifugation step. So there are a few centrifugation-free technologies like MAX, microfluidics, and just like a membrane-based live motor sorting, motor sperm sorting. And right now, the MAX is probably the least preferred method because it really cannot distinguish immortal sperm, and also there are insufficient data support on MAX. And also for the lab, it's more difficult to set up the device and workflow. For sperm sorting devices, it uses the timed event to select normal progressive motor sperm. We will have the sample going through the device, and it can increase the isolation of progressively normal motor sperm. And we collect this at the like a outer like a outlet or like on the topper like a area of the dish. So right now, I would say that worldwide, those two are the most commonly used device. Those two are the Zymote as well as the CA0. And also there are some on the right side, we have seen some of the more like a novel devices. It has been shown that it's not as easy to use. In my experience, I've tried most of those, and some of them like on the right side, the storage cup, it's good for the long-term storage, but for the sample coming into the lab, it's not, it's quite difficult to use, I have to say. So pretty much like Zymote and CA0 are the most commonly used. I've used both in my lab, and we will consider temperature and humidity requirements. For example, like Zymote has a higher requirement on the humidity, and we have to have a humidifier incubators. For the lens hook device, the temperature is same requirement as Zymote, but the humidity is less like a mandatory. So because its design is pretty much like a self-enclosed system, so the humidity outside humidity doesn't really affect the performance that much. And the user interference for the Zymote, we tend to push a little bit when we insert the syringe, and that kind of like forcing some of the samples through. And sometimes the outcome is okay, sometimes the outcome isn't that the ideal. For the CA0, it relies on the sperm's own like motility, and it tend to be, I kind of consider it's more like a naturally selecting the sperm out and easy to use as well. So this is the design of the lens hook CA0. So there are the structures trying to mimic the female like a reproductive duct, and also there's a membrane that the sperm going through and screen out those like non-motile sperms. The biggest benefit, as I mentioned, is it removes the centrifugation but also it simplified the steps as well the time we used in the lab. So before, it may take us like 60 minutes to process the whole process, DGC, swim up, those things. And now it takes 30 minutes for us when we go through those the CA0 device. Advantage of using those, which I found that it's gentle, as we mentioned, centrifugation free, it reduces DFI. It's simple, easy to use, it's fast, pretty much cut the time to half from the workflow. And it has excellent performance. It reduces the debris and also improves sperm quality. And one of the beneficial I have found that utilizing the mini CASA combining with the CA0, actually those two are very easy to use and shorten our workflow, and it free up a lot of time from our andrologists as well as embryologists, especially during the busy day or during the like weekend or holidays. I know everybody wants to go home as earlier during the holiday or weekends. So the combination of the X1 Pro or the upcoming X3 Pro as well as CA0 has been very beneficial for our lab. I'm going to discuss about a few literatures published talking about their experience utilizing the CA0. In this paper, the researchers found that the CA0 actually enhances key sperm parameters compared to DGC and microfluidics sorting. So the performance has been really good and better results, and especially in processing abnormal semen samples. Also, one of the issues in the lab processing the semen sample is the variance. Like if you have a 3 embryologists and they do this like a sperm selection and processing those, the outcome might be different. So this is comparing the CA0 versus the DGC. And we found that this paper found that the CA0 actually show a much better consistency between the observer and analyzer. And in this paper, they examine the euploidy rate of the embryos from different like processing method, the swim up versus CA0. Also, they found that the CA0 device processed the sperm actually outperformed the swim up. It have a higher euploidy rate, and it showed a lower aneuploidy rate. And also, the mosaic embryos has been highly debated areas. Some labs say, well, don't worry about mosaicism, let's transfer everybody, everything. And some labs still saying mosaicism needs like a more like a research. However, if we can reduce the percentage of the mosaic embryos, that would actually benefit, because the upstream, like I mentioned, the sperm quality on the upstream is very critical for the downstream outcomes. And in this paper, they found that in abnormal semen samples, the mosaic embryo formation actually has been reduced in the CA0 compared to the swim up samples. So the embryonic outcomes under different male factors still show that the CA0 is a reliable method to counter with even the different male factors. Also, it delivers like a really promising results in embryonic development. And the red dot is the Vienna consensus, like lines of the competency. So even with different male factors, the outcomes are still very good. Also, for the ploidy results of those embryos under various male factors, it shows that for even the normal zoospermic specimens, CA0 performs really better and much better compared to the swim up samples. And here is the data showing that CA0 better than the swim up. And how about IUIs? So a lot of us, we do the IUIs the first line, like a determination and also like a therapeutic approach for the patient coming into our clinic before we move them to the IVF. And some of them have clinical success with IUI. The researcher, Professor Lee, he's a well-known researcher in Taiwan. And Professor Lee has done this study on examining the CA0 effect on the IUI clinical outcomes. So they found that the IUI with the centrifugation, like a short, very quick centrifugation after the CA0, actually they can enhance the mortal sperm concentration and the recovery, as well as like a no negative impact on the DNA integrity. So research confirmed that using this device with just short centrifugation, not the full, not those like a long traditional centrifugation, just a short, like a abrupt centrifugation, it doesn't affect the DNA fermentation rate of the subsequent select sperm. Because for the IUI, one of the concern would be like we want to still concentrate and make the sample to the preferred volume we can actually put back to the patient. So sometimes the centrifugation may be still needed. So we can actually do the short centrifugation and not the traditional long centrifugation, and still works. So global IUI pregnancy rate has been like a success rate pretty much around like a 9% traditionally. And Professor Lee found that the pregnancy rate actually in their clinical trial, they showed that no clear trend related to cycle numbers or female age, and they actually achieved consistently about 15% of success rate. Also, by using the short centrifugation, which they modified the original protocol, and they found that this is a really unique and innovative approach, they can actually make the clinical pregnancy rate reach 25%. So indicate that the CA0 can achieve a significantly higher pregnancy rate compared to the DGC swim up, and also demonstrating its potential advantage in improving the IUI success. And Professor Lee is working on like more research and studies. They found that actually the pregnancy rate could achieve more than 30%. And also the sperm quality from the CA0 device can effectively improve on the pregnancy rate, etc. And also it can shorten the laboratory operation protocols compared to the DGC or some of the swim up. So the DGC is quick, but it also harmful. The swim up takes a lot of time, and oftentimes it still involves some centrifugation. So this like a live sperm sorting, the membrane that filter, like a membrane-based CA0 actually have the advantage of both, and kind of have a less advantage compared to both methods. And there's another study showing that the CA0 actually enhanced the IVF fertilization outcomes, and CA0 showed a higher fertilization rate and also the higher normal fertilization rate, which is very important. When we evaluate the lab outcomes, we not just see we not just check the fertilization rate. We want to make sure the normal fertilization rate is good, because those embryos will develop into a better quality embryo and less aneuploidy. And also the blastocyst formation is very important. So in this study, they show that cleavage rate, blastocyst formation rate, and the top quality blastocyst rate is comparable. And the CA0 results in the higher fertilization rate compared to the DGC. So cleavage rate, blastocyst formation rate, those are the numbers, as well as the top quality blastocyst rate. So even for some of the poor female factor conditions like a lower AMH and older age, the CA0 treated group still achieve a good fertilization rate, and highlighting the very strong effectiveness of this sperm selection. We call it smarter sperm selection method. And this study also demonstrated the first time that CA0 device actually have an efficient sperm selection method and significantly improved fertilization. And it provides a very reliable and effective approach as shown in previous studies as well as this one, and resulting in higher fertilization success. And here's another study show that the CA0 is good in optimizing the paternal genetic quality prior to the assisted reproduction. And this is the study and the results being shown here. It results in higher proportion of euploid embryos and significant lower rates of aneuploidy and mosaic embryos. So compared to swim up in processing, I mean the CA0 comparing to swim up in processing non-nomozoospermic specimens, the CA0 consistently show better results. Another study utilizing the piezo-ICSI method shows CA0 also improves the piezo-ICSI embryo development outcomes, so fertilization outcomes comparable, bractioration rate, the CA0 treated specimen is much higher, and ploidy outcomes, it has very significant like better outcomes. So we can see that based on those papers, the C0 can generate a better quality and also simplify the lab workflow. This paper showing that the C0 demonstrates superior embryo development. Those are the numbers comparing the bractioration and euploidy rate and also the mosaic rate. In summary, we know that fertility rates are declining globally, and male factors contributing to 50% of infertility. So there are factors we cannot control, like a lifestyle of the patient, and those we can encourage the patient to change, or some maybe like a medical treatment. However, when a specimen comes into our lab, we want to make sure we have a efficient and standardized lab workflows, which is very critical for better treatment success. And want to recover highly functional sperm, which preserves the DNA and also minimize the RS and DFI. And the smarter sperm selection actually is very useful, as those papers have shown, and also based on our lab experience. So the CA0, the network CA0, which I've used for a few years, is a very innovative and fast, gentle, and most critical part is the centrifugation-free sperm selection method. And with those studies showing that it can improve sperm parameters as well as better embryo development and clinical outcomes, and versus the traditional conventional methods. Thank you all very much for spending time for this webinar, and I believe we're open to the question and Q&A section. Right?
Yes. Thank you, Professor. That was very intensive, very in-depth presentation. Thank you so much for that. Uh, so I think we can start with the question answers. I would request if anybody has any questions, please post it in the chat box or Q&A section. Sorry. Uh, Dhaval, would you like to take the first question?
Yeah, thank you, Jayesh. So, I mean, definitely, it was an in-depth session and covered almost everything, right from traditional ways to modern ways, and at the same time, the quality part, which generally a lot of people miss in the presentation. So, thank you for that. One thing which a question which we have come across is with regards to the infectious cycle. The question is that what can be the better way to prepare semen sample who have virology infections like HIV, and what would be the best to lower the infection risk for these kind of patients and also lesser the DNA fragmentation.
Oh, yes. Actually, let me. Yeah, I actually have a slide for the HIV infection, but because of the time, I cut that out. So let
Ah.
me, yeah, let me go to that one though. So the HIV infections samples actually, let me see. So let me see if I have the HIV one. So when we handle in the HIV, so I'm just talking through the slide. So HIV, not just HIV, but all those like viral, like positive, and especially like discordant specimens. For example, the husband has HIV, but the the woman, the female, the wife, spouse doesn't have it. So we can see that first we'll check the viral load, and we can use the washed sperm, like intensive wash, because there's a research showing that the HIV discordant couples, they can achieve a clinical pregnancy and actually no HIV seroconversion. Like as long as the viral load after we wash, and we can send to test if you don't feel like a safe on the quality or something, we can do some like a zero dilutions and examine the quality and see the viral load. And those the combination of the DGC. However, in this case, we have to use DGC though. So I mean that's a kind of compromise. However, if we can combination use of DGC followed by the swim up has been proposed as a way of preventing the infection of the uninfected female partners. And those prepared samples, as I mentioned, should be tested, and only the HIV-free samples can be used for ART. So serial dilutions after DGC and swim up kind of wash out like a thoroughly. And however, in the lab, also we have a universal precaution in the lab. I want to make sure that the clinicians, the lab, the nurses, and everybody feel okay to handle those, because in many countries they only refer the HIV samples to certain, like maybe like a university or some facility has more like a secure design to minimize the cross contamination of those samples. Yeah. So that's overall, but each samples I would say it varies depending on the viral load. If you have really high viral load, maybe seek the treatment first, considering that. And if you don't have other options, I would say extensive like washing and TGC, swim up. Pretty much we throw everything on it to set the sperm.
Okay. So, Naval, I think before we move on to the question in the section, I would like to ask Professor that we know that CA0 has been linked with DFI detection. I mean, if you process semen sample with CA0, it reduces the DFI. I wanted to know if there is any study which is published which has shown an decrease in DFI with respect to double-stranded breaks. Has there any paper been published with respect to reduction of DFI with respect to double-stranded breaks after using CA0 or your
You mean
experience?
compared to the Huhuch method? Compared to
Compared to any method, I mean, has there been any articles which say that if you use CA0, there is possibility that it
yes.
also reduces double-stranded breaks, sperms with double-stranded breaks?
Oh, the double strand
Double DNA.
breaks. Yes, double DNA. I think there's a I believe there's a clinical trial it's working on. So yeah, I'm not sure if they published already because
Okay.
actually one of the things is the Bone Bio has this internal study. They have this X12 which analyze the DNA like damage. So
Okay.
they found that C0 HD helps on that case though. But I'm not sure if that's been published already.
Okay. Um, there is one question in the chat box, and it's asking, can CS0 sperm sorter be effective in selecting motile sperm and asthenozoospermic samples? Probably, if I'm understanding it correctly, the question would be in what would be the cutoff if the sample has a low motility or a low count,
Yeah,
and
right.
your experience with respect to such samples with low motility, low motile. What would you say that this sample uh, should not be processed by CS0 having extremely low motility or low count?
So I would say the threshold for each lab may vary and also depends on what you would like to do. If you want to use conventional IVF, I probably will shy away from using any of those, either the microfluidics or the CA0, because the yield will be lower. But if you have a borderline sample and you're thinking about doing ICSI, then we probably can try out. The good thing about the semen sample is the male can always come back and produce another sample. So I would say if we want to minimize the DNA fermentation and also the sample is borderline, we can try out with CA0. Or sometimes if the overall count is okay, but just the motility is low, then we can split the sample into just some swim up or just split into like two different methods. If it's really low count and low motility, I would say any device have their limitations. I will probably just do those, like I mentioned, like the low sperm count and like low sperm number tips. We can search individual sperm, even those like under microscope, searching the single sperm prep.
Okay. Okay. Great. Great. Thank you. Naval, any questions from your side?
Yes. So I believe that yes, I mean we do are progressing on microfluidics, and I think that's one such area where reduction of DNA fragmentation can help the patient. And as you rightly mentioned in your presentation in the add-ons, I think the only thing which was kept open, most of them did had a significance, that's like outcomes. But microfluidics for DNA fragmentation was shown that it can be used for medical indicated cases, and you can use it from patient to patient. So that's how this I think research has actually been progressing. And with regards to microfluidics, we I think not everybody still has an hands-on experience. A lot of clinics are not using it because of the financial constraints of having an additional chip being utilized. But it is a promising technology, and hence, as you rightly said, at times we do have to mix the manual procedure along with the advanced procedure, do half and half here and there, because it is the same which with regards to CASA also a lot of people are doing that. Not all the CASAs are entirely up to the mark, and hence at times you still have to use the user at the end of the day and its expertise to give the final outcome with regards to analysis, and not just completely blindly depend on that, right? So One question from my side is, um, when it comes to sperm sorter, when it comes to microfluidics, they two are different technology. It's not a true microfluidics. How much would be there a variability where a true microfluidics or even sperm sorter device? Because CS0 is very practical, I believe, but there are a lot of microfluidic device which go through some of the principles like Reynolds principles and everything. What do you feel is better, the basic science or still involving some microfluidics into sorting devices?
I would say the microfluidics is a good concept, and however, it depends on the design and the materials. Some of the microfluidics approaches has been that they they can sort out a lot of sperm, including the motor one and good quality ones. Then you end up with like a sample that has very low yield.
Right,
And on the other side, then if you open up the channel and say, well, I want to make more like a sperm going through, then you sacrifice the quality of that. So that's why I would say a lot of companies, even though they claim as a microfluidics, they kind of tend to move into the membrane filtered, membrane based. Yeah, maybe in 5 or 10 years we'll see different, maybe even more like a dynamic microfluidics, like also rolling dish or those things. Yeah, well, yeah, I'm very excited to see more devices coming up, and yeah, maybe we will see more like a newer version of the CA0 coming out to having different design. Yeah.
right. One thing which I think is also debatable right now is morphology versus motility. The increase of usage of microfluidics has led to also people that yes, motile sperms are the one which you have to first take care of. Just for sake of audience to understand, what's your take on it? Like uh, combination of both, or a priority or no, over a morphology or a motility?
Overall, I would trust the motility better because, well, one of the inherited challenge is the 4% cut off of the WHO.
Mm,
And if you see the proficiency testing in the United States, like a proficiency, they send out you the quiz, like
right.
you examine the quality, then everybody submit the answer. So the range could be from like sometimes from like a 0% to 27%, and the average is like a 8% or 9%. And I would say you can pretty much have like we say, you have animal or monkey shooting a dart on the wall and get the right number like that. And also the within the embryology inter operator
Mm,
variance. That's a big issue though. That's why I kind of trust the CASA even better than embryologist, because the consistency and all those. But when we process the sperm, I will focus on motility first. Then if I want to do the ICSI, I have a good motility sperm. I use PVP to slow them down, and I can select the best morphology I could have. Yeah.
right. Right. So first depend on the motility, and then with regards to whatever motile sperms you have, select the best morphology sperms out of them and go ahead with ICSI, right?
Yes, yes. Yeah. For the
Right.
ejaculate, I want to say that. Yeah, for
Right. Got it.
TC, well, that's as many
Ah,
as we could
yeah.
find. Yeah,
True.
yeah, yeah.
Also, I mean, just on the same point, many of the freshers or less experienced embryologists, they believe if the sperm morphology is absolutely fine, then there is no need to use CS0 or microfluidics or even test DFI. I wanted you to enlighten them on this topic, please.
So you mean like if the morphology is okay,
Yeah.
right?
Yeah,
Yes.
yeah.
So
Many inexperienced people feel that if morphology is fine, then probably DFI is also fine. So, with your experience, if you could help them understand,
yes. So I would say so research has shown that some of the morphology looks like they are still above the cutoff. Like I say the 4% is pretty much not much meaningful anymore. Then they still have a variance, like a variables in the DFI. So that's why actually with the in-house the DNA fermentation like a analyzer, we can actually look through that and see if some of the samples they look perfect, almost like a perfect morphology, but still have a DFI issues though. Yeah. So
Yeah,
I
the
would
bottom
say
line.
if the motility and the morphology are like feasible, we will try to go through the CA0 as much as we could.
Yeah. So the take-home message here is like analyze the case, analyze the patient's history, and then apply your experience and knowledge, and probably think through it. I mean, we need to think from all aspects while selecting a sperm or and diagnosing the case.
Preparation.
Yes.
Yes. So we have so many tools to use. However, I would say the embryologists and andrologists were still the most critical factor in the lab. Our experience
Right.
and continue learning and not being replaced by AI anytime soon. So.
True.
That's reassuring to many people out there.
Yeah.
Yes.
Yeah. Uh, do we have time for more questions? We're already running late, 15 minutes late. So, Naval, uh, shall we continue or shall we stop it?
Yeah, I think we don't have any more questions in the chat box. There was one question in Q&A and chat which we have already addressed. So, um, yeah, any more questions you have, Jayesh?
Um,
If,
Probably
if,
just
if
the last one. Yeah,
yeah,
just the last one.
that's allowed, yeah. Yeah, do we have a time for one more last question?
Professor, do we have time for one question? One more question or?
Oh, I'm free here now. So yeah, it's morning,
Okay.
so I'm not in a hurry now. Yeah.
Jayesh,
Okay.
please go ahead.
Yeah. So, one of the in one of the slides, to improve on DFI or to decrease on DFI, there was mention of antioxidant supplements. In your practice, how much antioxidant supplement has shown an improvement or reduction in DFI in your clinic or in your experience or in your practice?
So it actually varies. So in our practice and also in the different labs, I've been directing the different physicians. Some of them believe in those. Some of them say, well, there's no scientific evidence. So they will maybe prescribe those, and also in the some of cultural medium, there's a cultural medium acting the like antioxidants, and I I don't have a full confidence about which one works definitely best. It kind of varies. Sometimes we see the results getting better, but is that really the antioxidant or not? Then yeah, I don't feel that much confident about that. And also the H3 paper on the add-ons, they do not recommend antioxidant as a like a routine use. However, if it doesn't harm, maybe try out a little bit. Some cases it helps. I just don't know which one I definitely know it will work or not. So that's a problem.
Yeah, maybe clinic needs to decide on their own experience and their own uh, observations, and then go ahead with that.
Yeah.
Yeah. Thank you. So yeah, that's it from my side, Naval.
Right. So, thank you, Professor Arthur Chong. It was great having you. I think you covered everything, and it definitely throws upon a light for sperm preparation methods, along with what they are doing right now in the lab and what future holds, and how you can improvise on DFI and sperm preparation techniques using CA0. At the same time, I would like to thank even Bondre Bio for being here and also helping us to have you with us today, this evening, and IFA for having this engaging session. We had definitely almost 150 plus participants actually attending the session, so it has reached the masses, and it would definitely help us a lot. Right, so thank you for your nice presentation. I think one thing which you also said in your presentation, which a lot of people may not have actually listened to, is like few of the steps we perform, lesser is the compliance deviation, and that's something which is
Yes.
very requiring with regards to quality assurance. Keep it simple, we always say, but the human mind is always like, no, 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 we have to give everything, and then how the complications comes into the picture. So that's something which is a take home which even I would consider, because that's something which can come from a person who is actually from quality assurance background. For thank you for that, and I hope you have a wonderful day forward. So thank you very much, and for rest of the audience, thanks. With this we come to the end of the session today, and let's meet on the third Friday of the next month with another engaging topic and another excellent speaker to continue the academics and give across whatever we can from our side to all of you. Thank you, Officer.
Thank you.
Thank you, AFA.
Thank you,
Thank you,
Thank
Jayesh.
you
Professor.
so
Thank you,
much.
Chairman.
Yeah.
Yes,
Thank you.
And have a
Have a
nice
great day.
weekend, everyone.
Thank
same
you.
to
You
you.
too. Thank you.
Yeah.
Thank you.